Hi, I'm speaking to you from Orlando from the ASH meeting 2019, and there are a lot of exciting developments happening in acute myeloid leukemia, and the developments really continue to occur in trying to figure out what the best way is to treat patients who are unfit for standard induction chemotherapy. Over the last couple of years, we've seen the introduction of targeted therapies, as well as the introduction of venetoclax, which is combined with Vidaza in patients who are unfit for standard chemotherapy. And although those have provided us with opportunities to treat these patients, I still have to say that we've not shown that anything is really better than chemotherapy in terms of improving survival. And so we're also looking for agents that might allow us to be less toxic, but still provide us with some long-term disease-free survival similar to what we're seeing with chemotherapy. And one of the agents that's become available is an agent which is a cytarabine derivative. It is a drug that has been used as an aspacytarabine agent that is shown to have different kinetics but still provides patients with the effectiveness of cytarabine potentially without many of the toxicities as seen with cytarabine. So that allow us to administer chemotherapy to these patients again without giving them the toxicity that is seen with traditional chemotherapy drugs. This provides us with a potential way to get effective therapy with improved survival in patients who are unfit for standard chemotherapy. There was a presentation given yesterday by Dr. Jessica Altman showing the early phase 1 and phase 2 data using this agent in patients with acute myelogenous leukemia who are unfit for standard chemotherapy. The preliminary data is extremely encouraging, showing responses in patients, even those who have been heavily pretreated with hypomethylating agents for MDS prior to development of AML. So I think we now have another new agent to add to our armamentarium potentially for patients with AML who are unfit for standard chemotherapy, and we're looking forward to seeing how it'll be used in the future.